Good evening and thank you for joining us for KREM 2 News at 10. I'm Mark Hanrahan. COVID cases and hospitalizations once again on the rise in the state of Washington. State health officials are concerned because they believe the surge is linked to the new Delta variant. KREM 2's Morgan Trout live in the studio tonight. And Morgan, the health district says there's a long road ahead in the fight against COVID.
Mark, over the past week, the cases of COVID-19 Delta variants have doubled in the Spokane area. I was able to ask the Department of Health some questions about how they're able to differentiate between different strains. Right now, the Spokane Regional Health District reports 85 COVID-19 patients are currently hospitalized, with 272 new cases just today.
It is definitely increasing quickly in our community, and so it's something we need to be aware of.
Kelly Hawkins with the health district says the Delta variant, the highly transmissible and dangerous strain of the virus, is making its way into our community. Sequencing allows for the state to know which strains are impacting a community. The positive specimen is sent to a special lab. Researchers then use equipment to scan the genome, thus able to perform DNA sequencing. Once that process is finished, the scientists analyze the sequence to confirm.
It doesn't indicate exactly how many variants we have in our community, but it does give us an idea of the spread of variants and what we need to watch out for.
The Department of Health says that since January 2020, more than 33,000 specimens from COVID-19 cases have been sequenced. That's fewer than 8% of positive cases. But they told me that was actually a lot. CDC's COVID data tracker says most states only sequence 1%. They add their percentage is a total for a year and a half. But as of the month of June 2021, they dramatically increased the number of specimens, sequencing 23% of all confirmed COVID-19 cases. Hawkins says about 10 to 15% of the health district's cases are sequenced. The Delta variant only makes up 11% of the health district's cases, but more Delta variants are projected.
Well, looking at the national trend and even what we're seeing statewide, locally we tend to follow those trends, so it's not a good one. We could see an increase as expected.
It's difficult to know the current number of how many Delta variant cases there are because there is a lag time in getting this information. Sequencing can be performed on stored specimens at any time for a number of reasons, so they may not even be a current case. Initial sequence reports for July are starting to be received, but the reality is that the Department of Health isn't going to have a clear idea of what happened in July until late August or early September, when all the data has been received and analyzed. In the studio, Morgan Trout, KREM 2 News.